And sir, I'll invite Dr. Aditya Sudhalkar to sir present his real-world experience using the drug. And may I request Dr. Rohit to kindly introduce Dr. Aditya?
Good evening. Welcome, Dr. Aditya Sudhalkar. Dr. Sudhalkar is a well-known retinologist in Baroda. He is a visiting doctor and researcher in Germany. He has more than 30 publications to his credit and is one of the first users of brocellizumab. Thank you, Dr. Aditya, for joining this session. I request you to please begin your session.
Yeah. Sir, thank you very much for a very kind introduction and a very good evening to all. Thank you for inviting me for this talk, and I look forward to the other talks as well. They're very informative. So without further ado, I'll just go ahead with our presentation. This is just our clinic in Germany, and this is our director. I just want to state that I have full rights over the data that will be presented here. That is our German data. And I'll also be sharing a case from India that we've injected, amongst the first in India. So our first case is a 74-year-old retired physician from Germany, Bremen, who presented to us with metamorphopsia since 4 days and diminished reading ability. So the left eye vision was affected, and except for pseudophakia, there was nothing remarkable about the anterior segment examination. So the fundus photograph and the angiography is more or less suggestive of, a very evident CNVM. And now, just to give everybody a heads up, in Germany, the protocol is that you give 6 monthly injections of whatever drug you choose. Aflibercept is currently the standard of care, which means that you give for 6 months, you're injecting 6 units of aflibercept. And then you assess the patient at 6 months. So let's say he has a dry macula, you extend the treatment interval by 2 weeks, that is up to, instead of 4 weeks, you make it 6 weeks. And then if it stays dry after the 6-week injection, it goes on to 8 weeks and then 10, and then eventually up to 12. Now, with the publication of the Altair study, currently it is permitted to use 4 weekly spurts instead of 2 weekly spurts. And secondly, we can extend it up to 16 weeks, which means that effectively the patient has 3 injections per year. So in this case, unfortunately, we could not extend therapy even by 2 weeks because the patient continued to actually worsen despite regular follow-ups. So first he received 6 injections of aflibercept and then 6 injections of ranibizumab, and it still continued to get worse. Finally, we were able to switch him to brolucizumab in March. And this is after the first brolucizumab injection. As you can see, good resolution of the fluid and everything. The PED has started to flatten. And by the second, it was quite okay. So Dr. Raman sir, he mentioned about resolution of disease. And that is what ultimately we are aiming for. Now, at the 8-week visit, the macula was dry. But at the 12-week visit, we can see this little growth back here. So he received his fourth injection at 12 weeks. And then since then, he has been doing fine. Our second patient is a 78-year-old lady who belongs to a religious subgroup that actually goes to people and reads the Bible with them. So she came to us with a complaint of missing letters in the Bible. So on examination, the vision was not significantly affected, but it was affecting her reading abilities. And except for early cataract, there was really nothing significant about her anterior segment examination. Now, in this case, as opposed to the first case, the clinical picture and the angiography actually leaves room for doubt whether there really is a significant CNVM, although the PED and all is suggestive. And then, yes, we see certain cysts here. And normally, perhaps in India, we would not really, the patient would not be convinced for therapy. But in Germany, it's a different story. They are all, they all have universal health care. They can have as many injections as they want. And she wanted treatment. So she underwent the 3 mandatory injections as recommended. And she's doing fine. She's yet to receive her 4th injection. Excuse me. So this is what she has received. So case number 3 is again a 69-year-old Arab refugee from Germany who presented to us with metamorphopsia and inability to read the Quran since 1 month. So she had significantly affected vision. And in this case, the CNVM was well quite evident. So here what we see is that the CNVM after the first injection itself showed significantly reduced activity, and after the second injection it was resolved completely. So she received a 3 monthly injections, and then, as always, as is mandatory in Germany, after the 12 weeks, she receives her fourth injection. So if we see, we have now 30 patients with a 6 month follow up. 12 of those are treatment naive, and 18 of them are switch patients. So the findings are more or less in line with what we would expect with brolucizumab. But the main thing is we are yet to see any complications. So no inflammation, no vasculitis, nothing. Uh, Here what we have done is put up the number of patients who showed resolved intraretinal fluid, subretinal fluid, and sub-RPE fluid after one injection. And eventually, out of the 14 patients who had received this thing, it resolved in 13 of those. Now, coming to our local case, there was a 65-year-old. This was a 65-year-old male who presented to us in April 2017 with a complaint of metamorphopsia since 15 days. He had recently had cataract surgery, and although his vision was 6, 9, and 6, his amsler was positive, and his angiography, OCT, and OCT angio had been done elsewhere. So I apologize for the poor quality of the images because these are scanned images. Now, what is interesting in this patient is that the right eye also has some evidence of disease activity. So what we see here, this is the right eye, and what we see here is that there is waxing and waning subretinal fluid here in the right eye, which has he's asymptomatic. So in the past 3 years, we have not administered any therapy for the right eye. But for the left eye, what we see is that despite receiving a sizable number of injections, the disease has continued to worsen. So whatever is happening is in between, the disc and the fovea. So what we see is that he has received around 17 or 18 Eylea injections, 4 or 5 Accentrix or ranibizumab injections, 2 or 3 biosimilar injections, and Avastin. But he continued to worsen. Now, keeping in mind that this was exacerbated by the cataract surgery, we had advised him concomitant steroids from the word go. But he was a diabetic, so he refused systemic steroids. And then local steroids, he was apprehensive of IOP spikes. So ultimately, what did work in this patient was a combination of aflibercept and Ozurdex, and you can see the implant in situ here. However, 6 weeks after this combination therapy, we were back to where we started, and that at this point in time, we injected brolucizumab because by then it had become available in India. And this is the 1 week follow-up. Now, he was supposed to come for a 1 month follow-up on the 3rd, but in the interim, he has developed respiratory symptoms, and they're suspecting corona. So obviously, we said that there's no need to follow. However, this is from the 1 week follow-up visit, and this is his photograph. So obviously, we did an indirect ophthalmic examination, and we have ruled out vasculitic changes. Telephonically, the patient is doing quite well. He says he reports improvement in vision. However, having said that, his vision has actually never progressed beyond 636 N12. So we hope that perhaps with the second injection we can give him some better vision. So thank you very much for your attention. And as Raman said, we would be happy to take questions at the end of the session.
Yeah, thank you, sir, for excellent case presentations. And
Thank you, sir.
say great collection. And the best thing was that you were crisp and to the point. Great learning, sir, presentation.